Hello students, in today's video I am going to discuss about the MCQs based on the wall of thorax. So let's see the first question. During dissection of a typical intercostal space. So what is the key point? We are dealing with the typical intercostal space. A medical student observed that a particular muscle is absent near both anterior as well as posterior in the space. Clear? Which muscle is this? Now, when you are dealing with the muscles of intercostal space, there are three muscles: external intercostal, internal intercostal, and you will have the innermost intercostal, which is having three components. Now, when you will see these four options, the innermost intercostal or intercostalis intimi is the muscle which is not present on both the ends. This component of innermost muscle layer present in the middle portion. Clear? So the answer is C, because this is present at both the ends. Clear? So this both word is important because you may find some part present on anteriorly, posteriorly, but this component is strictly absent in anterior as well as posterior part of the space. So answer is C. Now the next question is, a surgeon exposed the typical costal groove. Clear? Now, which of the correct order of neurovascular bundle from above downward? So when you will go from above downward, it is VAN. Clear? So what is that? It is VAN. So vein, artery and nerve. So which are vein, posterior intercostal artery and intercostal nerve. Now the next question is, a chest tube is inserted to avoid injury to the intercostal neurovascular bundle. Where should be the incision is made? That means when you are having the two adjacent rib, this is the one rib, then this is the another rib. Now in between the two adjacent rib, this is the space which is known as intercostal space. And when you are putting a needle, so where should be put? Lower border of upper rib, that means this point. Upper border of lower rib, that means this point. Middle of the space and posterior to the rib angle. So this is not the answer. Now when you will see, these two will be there, but this is the most surface side, because in this area you will find the vein, artery, nerve. So where will be the what is the most suitable answer is the B. Upper border of lower rib of that space is ideal to put the incision. Now the next question is, a 40-year-old man undergoes thoracocentesis. Soon after the procedure, he developed sharp shooting pain along the intercostal space. Which structure most likely injured? Now here we are dealing with the pain which is along the intercostal space. Now dear students, you have to understand that whenever there is a problem with the intercostal nerve, the pain is present in that particular whole space. So it is a direct question that there is an injury of intercostal nerve, and that's why there is a pain along the whole space. Now the next question is, a step wound cut fibers running downward, forward and medially. Which muscle is injured in this intercostal space area? So downward, forward and medially. So this is the downward, forward and medially, and you know that it is a direction of fibers of external intercostal muscle. So the answer is C. Now the next question is, herpes infection of which nerve causes pain radiating to the medial side of arm? Now see, when we are dealing with the medial side of the arm, the herpes infection of which nerve? So here when you will see these four options, it is actually the T2, that is known as intercostobrachial nerve. Now this T2 nerve is not only supplying the adjacent chest wall but also the inner and upper part of the medial side of the arm. Clear? So the answer is B, T2, because herpes infections are common on the chest wall, and from the chest they are going to the medial arm with the help of T2 nerve. Now the intercostobrachial nerve is a branch of, I just told you intercostobrachial nerve is a nerve of T2. So it is a lateral cutaneous branch of second thoracic nerve, that is T2. Now this is the next question. In most of the intercostal space, the intercostal nerve lies between. Now see, whenever you are dealing with the three layers, external intercostal, internal intercostal and innermost intercostal. So where you will find in between these area or this area? So the answer is that your nerve lies here. Now which is the muscle? Innermost and internal intercostal. So where is the option? Option is C, that nerve lies between the internal intercostal and innermost intercostal. Now I'll move to the next question. Posterior intercostal arteries from 3rd to 11th space arises from. Now, when you are dealing with the intercostal arteries are posterior and anterior. Now, we are here asking about the posterior intercostal arteries, and the posterior 3rd to 11th arises directly from the descending part of thoracic aorta. So, answer is C. Now, we'll move to the next question. First and second posterior intercostal artery arises from. So now it is again asking about the posterior intercostal, but first and second particularly. In the last area question, it was 3rd to 11th, and in this question, first and second. So which is the answer? It is a direct information based question. The first and second posterior intercostal branches of superior intercostal artery. Clear? Now we'll move to the next question. The right posterior intercostal arteries are longer and they passes behind all the structure except. Now see, why right posterior are longer? Because your thoracic aorta is not a midline structure, it is towards the left side. So because it is towards the left, so left are shorter and right are longer. So these right longer are passes behind all except esophagus, thoracic duct, azygos vein, hemiazygos vein. Now see, if you will even don't know the course and if you will see the option, you can see that hemiazygos present on the left side and we are dealing with the right sided arteries. So but obviously by this knowledge you can say that answer is D. But if you will read the course of right, it passes behind the esophagus, thoracic duct and azygos vein, and hemiazygos is present on the left side. So but obviously these right arteries never pass behind this hemiazygos. Now, which posterior intercostal artery give mammillary branches? Now, when you will see this, the mammillary branches, that means which arteries are supplying the breast. So, answer is 2nd to 4th. 2nd to 4th intercostal arteries will give the branches to the mammary gland. Now, the next question, posterior intercostal artery end by anastomotic at what level? So when you will see the intercostal space, one posterior intercostal is coming from back and there are anterior intercostal coming from anterior side. So anterior intercostal are the branches of internal thoracic and posterior intercostal coming from the aorta. Now they will anastomose in this space. So at what level they anastomose? Answer is at the junction of costochondral area. So at the costochondral junction, the posterior intercostal anastomose with the branch of anterior intercostal artery. Now, internal thoracic artery arises from. So it is a direct question. You know that it is a branch of subclavian artery. So, but which part? First part of subclavian artery. Now, the next question is which artery is commonly used for coronary bypass? Now, in the coronary bypass, we are using the internal thoracic artery. The distal end of the thoracic artery will mobilize towards the coronary areas where you want to implant it. Now, majority of right side posterior intercostal veins mainly drain into. So whenever we are dealing with the venous drainage of the chest wall, you know that there is a azygos system of vein. So it is the right sided veins. Now right sided vein mainly drain into the azygos vein directly. So answer is C. Now what is the next question? The next question is that left posterior intercostal veins. So we are dealing with the left side venous drainage and specifically 5th to 8th intercostal space. So 5th to 8th intercostal posterior veins drain into which? Answer is accessory hemiazygos. Answer is accessory hemiazygos. It is the B answer. Now we'll move to the next question. Azygos vein enters the thorax through. Now there are 4 openings are given. So this is the important thing to understand, that azygos vein always enter through the aortic opening. Azygos vein enter into the thorax with the aortic opening. Clear? Now the next question is In superior vena cava obstruction, after azygos vein opening, venous return reaches the inferior vena cava mainly through. What does it mean? That this is your brachiocephalic vein. This is your two brachiocephalic which are joining to form the superior vena cava. Now this superior vena cava is receiving the azygos vein. Clear? Now it is the superior vena cava obstruction after azygos vein opening. So this is the opening, and after that, suppose there is an obstruction. Now how the venous drainage of superior vena cava will go in inferior vena cava? Now the answer is thoracoepigastric vein. Clear? So what is the answer? B, thoracoepigastric, because it is after the azygos vein opening. If the question is before the azygos vein opening, if suppose the blockage is there, clear, then how the blood will go? Then we'll have the involvement of thoracic veins. Clear? So this is the important thing. If you will have the after the opening, then it is thoracoepigastric vein. Now the next question is thoracolumbar sympathetic outflow. It is answered directly on your knowledge. It is T1 to L2. Where is the option? C, T1 to L2. Now the next question is cardiac pain is referred to the left arm because sensory fiber enters the spinal segments. So which spinal segments are responsible for the referred pain of your coronary arterial spasm in the medial side of arm? Answer is T1 to T5. Clear? This is very commonly asked question. Please keep this thing in mind. Then the next question is sympathetic stimulation causes all the effects except. Now, dear students, these are one of the very simplest question, because whenever you are dealing with the head and neck parasympathetic supply, you know that all the salivary glands is stimulated by the parasympathetic stimulation. So, increased salivation is a parasympathetic stimulation. We are dealing with the sympathetic. So, answer is D. It is not the function of sympathetic system. It is parasympathetic. Now, the next question is a patient present with the band-like pain around the chest wall following herpes infection. This pattern of pain is due to involvement of which of the following nerve? Now, see, the question is very long, but if you will see the option, it is very easy to attempt that whenever you are having the herpes zoster infection in the chest wall, I just told you that herpes always follow the course of a intercostal nerve. Clear? So, why there is a pain? And this pain is having a classical band-like pain. Clear? Now, what is the option? Dorsal rami of thoracic spinal nerve, ventral rami of the spinal nerve, supplying abdominal wall, typical intercostal nerve. So, answer is C. Whenever you are having the typical intercostal nerves, they are actually known as ventral rami, and these ventral rami are supplying your chest wall. And whenever there is a pain along with the intercostal space, that means your viremia, your herpes zosters are now spreading along the course of typical intercostal nerve. Now, what is the next question? 45-year-old man present with the burning pain along the lower part of chest wall. So, where you are dealing? You are dealing with the lower chest wall over the lower ribs. Clear? So, this is the problem where the patient is having the pain along the lower chest wall in lower ribs. But this pain extends into the upper abdominal wall also. There is no history of abdominal pathology. Now, what is the significance of this line? The significance of this line is that patient is having abdominal pain without involving the abdomen. That means there is a referred pain in the abdominal wall from the lower chest ribs. So, there is no history of abdominal pathology. So, this pattern of the pain best explained by. So, whenever you are having the involvement of lower chest and abdomen, that means we are dealing with a nerve which is supplying both lower chest as well as abdomen, which are known as thoracoabdominal nerves. So, referred pain from gallbladder, no, it cannot be the answer, because gallbladder pain go to the shoulder. Visceral pain from the abdominal organ, no, it is again not the answer, because we are dealing with the abdomen and chest both. Involvement of thoracic intercostal nerve supplying both chest as well as abdominal wall, yes, because these are the typical presentation when there is involvement of thoracoabdominal spinal nerves. Clear? So this is the answer C. Now I'll move to the next question. The following statement concerning an intercostal space are correct except. So you have to check all the options regarding the intercostal space. So the anterior intercostal arteries of the lower four intercostal space are branches of superior epigastric. Is it right or wrong? So I think this first option is wrong. Why? Because when you will see the lower intercostal arteries anterior, they are generally the branch of musculophrenic, not the superior epigastric. The sensory fibers in the lower five intercostal space supply the skin of lateral thoracic as well as the anteroabdominal wall. Yes, I just told you thoracoabdominal nerve. It is right, and these are the lower five. So lower five means 7 to 11. The posterior intercostal arteries of the lower 9 are the branches of thoracic aorta. Yes. The intercostal nerves and blood vessels run between the internal and innermost intercostal muscle. Yes. So all the following are true. B, C, D except A. So A is wrong because this A is saying that lower anterior intercostal are the branch of superior epigastric. It is a wrong statement. Now I'll move to the next question. Which of the following statement is again not true about splanchnic nerves of the thoracic sympathetic trunk? Now when you are dealing with the splanchnic branches of thoracic sympathetic trunk, you have to understand that these are basically preganglionic. These are preganglionic nerves. So they carrying preganglionic sympathetic fibers. It is right. They passes through the crura of diaphragm. Yes, it is right. They synapse with the paravertebral ganglia. They synapse in the abdomen via the prevertebral ganglia. So please keep this thing in mind that there are two words, paravertebral and prevertebral. Now see, when you are having these two things, you have to keep this thing in mind that paravertebral ganglia are basically another name of sympathetic ganglia of the chain itself. And these splanchnic now come out from the paravertebral itself. So they cannot synapse in the paravertebral, because the paravertebral or the sympathetic chain will give rise to the medial branches which are preganglionic, are known as splanchnic nerve, and ultimately they will reach to the abdomen where they will synapse with the prevertebral ganglia. So all are true. This is also true. The answer C is wrong, that they synapse in the paravertebral. Basically the paravertebral give rise to the splanchnic nerve, not synapse. Now we'll move to the last question. A 45-year-old man undergo abdominal surgery. Post-operatively, there is a damage to a nerve carrying preganglionic sympathetic fibers from thoracic ganglia to the abdomen is suspected. Which nerve is most likely injured? So I just told you that preganglionic fibers from the thoracic ganglia are going into the splanchnic nerve. So there is only one splanchnic nerve is given in the option. Answer is B. Clear? So dear students, in this way you will have the clinical scenarios based question from this part of your thoracic anatomy. Clear? Now again I am saying this, that whenever you are attempting the questions, you have to keep this thing in mind that if the scenario will change, your answer will change, or even if the options may have the some twisting, then you have to use your knowledge before attempting any question. Now I am generating the QR code, and by scanning this QR code, you can download these PDF, or you can revise these all questions before your exam. So this is all for the session. Thank you and bye-bye.